Well, hi everyone. Can you hear me? Yes. Okay. Well, we were just waiting for KS Park to join us from Korea because I'm not sure I'm seeing him here. But for the sake of time and to be really on time, we could start and then hopefully he can make it on time too. So I'll ask everyone to be on to mute your microphone, please. And we just kept the cameras for people that were gonna speak now, just because I think we have a lot of people on the call. So I think that will make it things easier. So just as a very quick introduction. So I would like to give good morning for everyone, or good afternoon, or good night, depending on the time zone. And we hope everyone is well at home or wherever it's safe to be at the moment. And let me introduce myself. My name is Selena, and Project Director at ITS Rio. And it's so really excited to be part of this true global conversation that will discuss about the use of data as part of the strategy to counter the public health crisis caused by COVID-19. But first of all, I would like to thank our colleagues at Berkman Klein Center for supporting and helping to put together this call, and also from our friends from Korea and Singapore who kindly agreed to participate even though it's really late over there. So just to make the best of this 1 hour, I will very briefly introduce our guests and the agenda. So before some just housekeeping rules, please again keep your mic muted. We'll have this conversation be recorded, and please, if you have questions, put it on the chat. That on the end we'll get back to them so we can go and ask our speakers to address them. So as our co-host, we have Professor Urs Gasser from Director at the Berkman Klein Center, who is also focusing research about contact tracing. We have also Dr. Leo Anthony Selly, who is the principal research scientist at the MIT Laboratory of Computational Psychology and is also founder and co-director of SANA, a cross-disciplinary organization based at the Institute for Medical Engineering and Science at MIT, whose objective is to leverage information technology to improve health outcomes in low and middle income countries. We have also the participation of Malavika, who is from India, but is currently based on Singapore and is also the director of the Digital Asia Hub. We have Professor Eldar from the Haifa Center for Law and Technology from Israel. Dr. KS Park, who we're expecting to join from Korea. And lastly but not least, Professor Carlos Afonso, who is director at ITS Rio, will be speaking from Brazil. So I just suggest that we start with Dr. Leo, if that's okay, who will provide us with a taxonomy of the different measures and applications of the use of data that are being implemented so that we are all on the same grounds. Then we'll turn to each speaker that they have more or less 5 minutes to describe about their base country experience. And then we turn back to Dr. Leo to comment on these measures. And if all goes well, we'll have around 20 minutes for Q&A, okay? Can we start? Or do you wanna say anything before we pass to Dr. Leo?
Well, just very quickly, thank you so much everyone for joining. It's a great group. We have more than 104 participants on this call. I want to be very brief, just add maybe that this is an initiative by the Global Network of Internet and Society Centers, which also brings together more than 100 centers around the globe. And we're excited to have a second conversation a few weeks ago. Some of you may have joined an initial conversation with Yves Dacor, who I see also on this screen. So welcome back, Yves. It's great to have you. I'm looking forward to the conversation and just want to give a shout out to my colleagues at Berkham Klein, Amrasher, Sandra Cortesi, and the entire team has made it possible together with our partners in Rio. So thank you, Selena, and over to you.
So please, Dr. Leo, thank you very much for accepting this invitation such a short notice. So if you could explain us a bit about all these measures that we'll be seeing so that we are all on the same ground, and then we hear from our colleagues around the world.
Good morning from Cambridge in Massachusetts. I was given the very challenging task of providing a landscape of the role of technology in this pandemic. So as Selena mentioned, my research focus is on the application of machine learning on health-related data, but I'm also an intensive care unit doctor. I have been working at the front lines. And just to give context, I will give you a very brief summary of where we are at our hospital in Boston. So we have expanded our capacity to take care of patients in the intensive care unit from 75 beds before the pandemic hit to currently 150 beds over a span of 1 month. So far, we have had 142 patients with COVID-19 who needed a breathing machine or a ventilator. And about half of those, 73, are still on a breathing machine at this point. We have had 42 patients who we have removed successfully from a breathing machine, and about 20 of these have been discharged out of the hospital. And 27 of the 142 patients who needed a ventilator have died. So the first technology that I wanted to talk about is intensive care units and ventilators. There have been a lot of talks about mass producing low-cost ventilators, but the reaction of the people who work in the intensive care unit is that low-cost ventilators will not address the true bottleneck. The true bottleneck are the nurses and the doctors who could manage patients on a ventilator. What I wanted to point out is that it is very easy to kill a patient if one does not have the expertise to work in an intensive care unit. And I also wanted to point out that one of the problems that we're facing now at the front lines is that we're having a shortage of medications to keep patients sedated. So a patient who is on a ventilator will need some medication because it is like having a tube stuck down your throat, and it's going to be very difficult to breathe in synchrony with the breathing machine. The next technology that I wanted to discuss is mass testing. As most of the people here would know, mass testing is key to flattening the curve and also for reopening businesses. And I hope we will hear from some of our colleagues about their experience in mass testing. And I just wanted to highlight what happened in Korea. By late February, Korea was testing more than 10,000 people daily. And as a result, cases peaked by the end of February. And since April 5, only around 50 new cases daily have occurred nationwide in Korea. And one of the reasons why we think Korea has been very successful is the availability of mass testing. And there are really two different tests that we use to be able to diagnose COVID-19. The first one is Rt-Pcr. This test has a very high specificity but low sensitivity. What does that mean? If you're positive, we know very well that you're indeed infected, but if you're negative, it doesn't guarantee us that you indeed don't have the infection. At Beth Israel Deaconess, where I work, we need 2 negative tests taken 24 hours apart before we say that you do not have COVID-19. For all tests, the accuracy is highly dependent on the prevalence of the infection in the population. So just be very aware of that when you look at numbers in terms of sensitivity and specificity. The other test is looking for antibodies in your bloodstream, antibodies to the virus. Yesterday, there was a big news coming out of New York City. They found that 1 out of 5 people who live in New York City are positive for the antibodies. But we don't know the accuracy of these tests. We don't know how many of those are false positives or true positives. And we also don't know if the antibodies provide immunity, and if it does, for how long. We have heard about cases of repeat infections, for example, in Korea, who have had COVID-19 documentation. Who need to get tested when we talk about mass testing? For sure, healthcare workers would need to be tested. All patients who are being admitted would need to be tested. And the reason for that is there's a high prevalence of patients who are infected and who are contagious who don't have any symptoms. The other vulnerable population who will need to be tested would be those who reside in nursing homes, those who are in homeless shelters, those who are in prisons, because this could be hotspots for transmission. And lastly, contacts of positive cases. We are going to hear about digital tracking. And I think studies after studies have pointed that digital tracking is probably the only effective strategy for contact tracing. And why is that? The studies that have been done suggest that to achieve effective control, contacts must be quarantined within 24 hours. And virus transmission is simply too fast, and manual contact tracing is too slow to be able to curb this pandemic spread. And finally, the most important amulet that I think in terms of technology that will save us from this pandemic is data modeling, data analysis. We need to understand how the virus spreads and how the virus kills. More than ever, we need to crowdsource knowledge generation and validation. Our best defense against the virus is our ability to learn from the data. As Yuval Harari said, a virus in China cannot exchange notes with a virus in Italy so that they could infect and kill humans faster. But researchers around the world can join forces and share data to best understand the enemy. And with that, as a brief overview of technology, I will pass it back on to Selena. Thank you.
Thank you very much. No, but that was very helpful. So now I'll hand it over to Malavika, if she could explain a bit to us how things are going back in Singapore.
Hi, can you hear me, Selena? Yeah, okay, great. Thank you so much for having me. This is a really important initiative and I'm really glad to be part of it. So as Selena said, I'm currently in Singapore and we've got a lot of firsts. We've been the gold standard for all kinds of things, the gold standard for contact tracing, the gold standard for testing the most number of people per capita. And I think we got a little smug because now we're also the gold standard for inequality. And I think what's really interesting is one lesson for Singapore is that there is a risk that you can get too complacent with this. If you're doing really well, you think you've beaten the system. And well, actually, that's not the case. So we're facing a second wave, one, because of people who were outside the country when things were bad, who've come back from Europe and the US and have actually reinfected people here. And the second wave is due to migrant workers who live in pretty horrible conditions in dormitories. And I think if I had a penny for every time someone said the virus doesn't discriminate, I would actually have a counter that the virus might not discriminate, but there is structural inequality. There are systems that discriminate and people who discriminate. Because what we're finding in Singapore is it's almost like there are two pandemics going on at the same time in parallel. There's one where people, until a couple of days ago, were still able to do life pretty much as normal. We weren't working from our offices, we were working from home, but we could still go out to restaurants. Then that slowly, through circuit breaker measures, because nobody wants to call a lockdown and have panic, we had circuit breaker measures where we reduced the proximity of people. We had more social distancing measures. And then slowly that's got ratcheted up to a point where you can no longer eat out, but you can do takeaway and delivery. But at a time when everyone else could exercise, could go outside, and we were pretty lenient, we didn't have a full-scale lockdown. A completely different story was emerging with construction workers and other migrant labor, which come from poorer countries in Southeast Asia, largely India and Bangladesh. And it's giving rise to a very huge and very important discussion about inequality, because these people live in dormitories in very close proximity where the idea of social distancing is shown to be such a privileged idea. It's lovely to be able to socially distance yourself, but if you're in circumstances, if you're in accommodation, or if you're in work where it's completely impossible for you to do that, it raises very, very serious questions about who is able to protect themselves and who is vulnerable. So we've had, in 3 days, the numbers have ratcheted up. We had 5,000 cases in 3 days, and now it's gone up. So we've gone from being one of the best countries in Southeast Asia to being the highest number of cases in the span of a week. And 80 to 90% of those are migrant labor. And they are people who don't have access to water, who don't have access to bathrooms. They have something like 5 per 100 people. They're unsanitary. And there's a certain question of visibility and invisibility, because these are people who live in neighborhoods that aren't the shiny, beautiful steel and concrete jungle or the beautiful, lush tropical areas that the rest of Singapore is. They live far away in areas that people, even Singaporeans, don't know exist. And they live under conditions of vulnerability and precarity that make them ripe for this kind of a pandemic to just run through the dormitories and facilities that they're in. So that's the kind of reality we have, where there are 2 different pandemics in place at the same time. So I'll just very quickly talk about the Trace Together app, which is something that Singapore helped to pioneer, which was one of the models of contact tracing. It was an open protocol. They very deliberately did it as something that could actually help other countries. They built it to be open source. They built it so that other people could borrow and not start from scratch in the time of crisis. It was a privacy first application. Singapore has a very robust AI governance framework where they have 3 models for human in the loop, human over the loop, and human out of the loop. In the particular circumstances in Singapore, they opted to use a human in the loop system for the Trace Together app. But as the GovTech people have said, it's eminently possible that another country might want to make it even more decentralized and create a human out of the loop system. But some of the key features of this app, it stores location data and other data locally on the phone, not in a centralized manner on the server. The data is never decrypted, even during the data being executed and moved. The data trails are never released in the public domain in the raw form, and it's never sent outside borders or even outside particular hospitals. So those are some of the features that have made this a very important thing. And I know there are similar apps, like I'm sure Eldar will talk about the Hamagen app in Israel, the Shield. But this is sort of the thing that Singapore has been known for in terms of contact tracing. And it's not without flaws. There are people who've tried to actually analyze it and audit it to see whether it actually meets the privacy promises that it makes. And there has been a report recently by a Thai digital rights organization called Digital Reach, which actually said that the code is pretty obfuscated. It's very hard for independent verification against these privacy promises to examine the application's function and the government's claims. And they've also made a claim that if the app is really going to be open source, the complete source code of the app should be released, not just the Trace Together protocol. It shouldn't just be the specification and the reference implementation, it should be the entire source code. And the other risk that they pointed out is that there are risks of Bluetooth being perpetually turned on 24/7 to support the app's function, particularly for people whose phones don't receive security updates. And that's a problem given the other kinds of cybersecurity threats that we've seen recently. Zoom is the most common thing that we've heard of, Zoom bombing and other things. And so this app is not immune to those kinds of hacking attempts as well. So I'll just leave you with those sort of introductory thoughts, and I'd love to hear from everyone else. Thank you so much.
Thank you very much, Malavika, especially for keeping in your really small time. I just saw that KS arrived from Korea. If he could go next.
Okay, thank you. Can you hear me?
Yes.
Instead of, I'm in my wee hours now. Instead of showing my video, can I share a screen? Can I share a document? Let me. Okay. There you go. Okay, I'm trying to. I think
you need
you
to
have
be a
to
co-host. Yes, someone on the Berkman team, please make KS a co-host. Thank you.
Now you're a co-host.
Okay, good. Now I'm gonna share this. Let's see. Okay. Okay. Can you see this document here?
Yes.
Yes. Okay. So as you know, Korea has done very well with the massive testing, and it has basically kept the curve low so that the health authorities are not overwhelmed with incoming patients. So even the fatality rate has been kept low. Now, people wonder how Korea has done such massive testing. Yes, because it has prepared early in advance all the test kits, but also it has allowed location tracking of not just patients, but also people who were in contact with the patients, but also not just them, but also people who are suspected to be in contact with patients. All the location tracking against the wills of patients or contacts or suspected contacts. And this law was, Article 76(2) of Infectious Disease Control and Prevention Act. This was passed into law back in 2015 during MERS outbreak. As you know, during MERS outbreak, Korea was the only country outside the Middle East where it had a substantial number of infected people and deaths. So that taught the country a lesson about the need for information on where people go, which business, what shops, restaurants the infected people have gone to. So Article 76-2 of Infectious Disease Control and Prevention Act allows health officials to acquire information such as names, resident registration numbers, addresses, telephone numbers, prescriptions, records of medical treatment, records of immigration control, credit cards, transit card records, and CCTV recordings from all third parties. So we are talking about the restaurants, credit card companies, all the operators of CCTV. And clause 2 of the same article allows not only health officials, but also administrators of municipalities and municipalities. So we are talking about mayors or borough chiefs, small administrative district heads can also collect the location information. At this stage, the information is not as expensive as medical treatment or CCTV recordings or credit card records, but at least the location information from telecom operators. And again, this is, as far as I could research, this is unprecedented around the world. There is no judicial approval. There is no judicial oversight on how this information is collected. What is even worse is that this is done through police. So if health authorities identify a patient and want the whereabouts of that patient for past 14 days, they ask the police to get it from credit card companies, the telecoms, and all these providers, and then turn over to the health authorities. I believe this is the one of the I believe the closest a country has come is Singapore. But even there, I think the information is not as expensive as what the country could do, what Korea could allow access to. I know that Israel has similar laws allowing such access, but is temporary, and I understand that it is under, like, wartime like power, which has a sunset provision. So we are concerned because this may create a slippery slope where the mandatory non-judicial location tracking can take place without can take place outside the context of criminal investigation. As you know, criminal investigation has been considered important enough to justify violation of privacy or infringement of privacy, but this one maybe is the first one outside the non-criminal. This one is the first one outside the criminal context. But I'm willing to bend on this because this worldwide threat is new to all of us, and maybe in a crisis such as this, this type of data collection maybe should be allowed. Maybe this disease is really civilization changing, and maybe we have to rethink about the warrant doctrine, which has been kind of the rule of thumb in deciding where to draw the line between public safety and personal privacy. And then there is another location tracking done. This is prospective location tracking. What I talked about so far is retroactive location tracking. Finding out about finding out about the whereabouts of the person in the past. But now the government, starting next week, will start putting on location tracking wristband on people who are under the quarantine order. Now, quarantine orders are, laws allowing quarantine orders are everywhere, not just in Korea. This is nothing new. So the quarantine law makes it a crime to violate the quarantine order. So basically this wristbands, this location tracking is done to make sure that crime doesn't happen. So I think that there is a less privacy concern here than retroactive location tracking, because see, once you are under quarantine order, you do act carefully, and you don't go out, do things that will, put you into shame. But retroactive location tracking, it hurts privacy more because, people, when you think that you are not watched, and when you think that you will not be watched, you will be doing things that will really reveal a lot about yourself. But still, I know that a lot of focus is on the prospective tracking. So I'm going to talk a little bit more about that. Now, we thought that, I mean, this one was an easy sell because the law was, well, easy sell in the Korean context. The law was not there to force people to wear this app or wear this wristbands. Yes, quarantine law makes it crime to violate the quarantine order, but to force someone to put something on their body or to install some software, there had to be another law. But fortunately, Korea was going through a general election at the time. At the time the government was considering this, so they couldn't pass the law, and we blocked this. We blocked this particular law, saying that there is no statutory ground. I don't know whether they're going to try again because now that election is over. But right now they're going to start next week, only upon consent. So I'm expecting a lot of people to give consent and wear the wear.
Yes.
I think I went over time. I'm done. Thank you.
Thank you. No, it was really, really interesting. It's really a shame that we have this time constraint. But let's go quickly to Eldar, and then hopefully we have some more time so that we can continue to hear a bit more, because this is super interesting. Thank you for sharing this information. Eldar, if you don't mind, your 5 minutes.
Okay, so hi everyone. Good afternoon from Israel. Thank you so much for organizing this. It's so super important in this time, and I think that there's much to discuss within the NOC as well, and all the participants who came as well. So that's excellent. I'll shortly talk about Israel experience regarding data collection and use within the COVID-19 pandemic, and I'll briefly talk about them I'll divide them into 3 themes. The first would be regulation through information. This is, I would expect something which might be unique to Israel. I'm not sure. Hopefully I'll hear maybe someone will comment about that as well. The second is surveillance, which we talked about, and I'll talk about the Israeli experience. Then the third one is the voluntarily disclosure of data, voluntarily data sharing, which has 2 phases in Israel. So regulation through information, what I meant here was that when the pandemic began in Israel, what we saw was that we had a public reporting of the routes of people that were diagnosed with the virus. So you would see it was supposedly it was privacy enhancing a way to alert us because it was anonymized. However, so you would see patient number 200, for instance, walked in the last 2 weeks, was in this coffee shop and that coffee shop between that time and this time. And then you were supposed to go online and see the media reports and to understand whether or not you were in some close contact with that. So that's basically seized because first of all, it's ineffective when you have 15,000 people who are known cases or who were affected by the virus. And second of all, there's a lot of privacy issues there as well. It's not the reason which is seized, I think, but there was privacy issues because it's anonymized. But as we know from anonymization, it's relatively easy to trace them back and know that if someone works somewhere and he was there or she was there all the day, we know who it is. And there's a lot of privacy issues right now that occur from that, because if you consider the fact that we don't have a right to be forgotten, for instance, this remains online for good, probably. In terms of surveillance, which is the second prong, what happened in Israel, much like we have heard about South Korea, for example, but other places as well, we have emergency regulations under which the government authorized our internal security agency, which is also known by its Hebrew acronym, the Shin Bet, to collect information from private cell phones. So more accurately, it doesn't have to collect right now. It already has its trove of information, which is, as K.S. Park said, collected for other purposes, but now they had to, it was terrorism, anti-terrorism purposes. Now they were actually asked to use this for this pandemic, to fight this pandemic, and it was approved, and it wasn't approved by law, but by the regulations. And then we had a lot of discussion in the Supreme Court as well, because we didn't have an oversight committee. Then there was an oversight committee, and it was approved, at least for the time being. And what happened there is that the Shin Bet was engaged in tracking down the route of those who are ill, or those who are suspected of being ill, those who have been contacted or in the proximity of those who are ill. And then the police, with the Ministry of Health, would use the location data and enforcement of the quarantine by law. So there were a lot of different issues here, legally speaking. It attracted a lot of academic and civil rights attention. There were petitions to the Supreme Court. Some of them were met. Some of them are still pending about the legality of these things. They are not passed by laws. I will not get into that very closely now, unless someone will ask in the Q&A, because I only have about 1 minute and we want to keep time. But notably, this thing is still one of the things that we are doing in sense of digital tracking. One of these programs ceased for now, but it will probably continue via law. The last point I want to talk about in my last about minute of talk is the voluntary data sharing. So Malavika talked about the Trace Together app. I will talk about the Shield, Hamagen in Hebrew. But first of all, I find it intriguing that anyone can report those who violated isolation, for instance, through a simple form through the Ministry of Health website, which is an interesting idea by which you can tell about your neighbors or friends that they are not within the order. But that's, I will put that aside for now. The Shield, or Hamagen, is a voluntary app that was launched by the Ministry of Health. It's an interesting story because it's actually what it does. It tracks. It's voluntarily. You have to consent. You're not obliged, not yet at least, to download it. If once you downloaded it, the app will track your whereabouts and it will compare it to the route of those diagnosed with COVID-19, and it will check if the path was crossed within the previous 14 days. So it is a good app to a great extent. Why? Because it's consensual first. Very basic of privacy usually depends upon consent. It's very easy to download and implement, and here it was very highly advertised over the news. It embeds privacy by design principles because the data is only processed, much like Malavika said in the example of Trace Together app, only locally on the device. So it retains information about locations solely on the device. It cross-references on the device with the Ministry of Health updated data. And then, the user can decide whether or not to report it whenever he or she knows that they have to go into quarantine. So it has a lot of great things because it's open source and you can see the code, and a lot of experts have actually made sure that it works. There are security vulnerabilities like always, so it's not perfect, but it does promote a lot of values of mutual social responsibility, and there's no direct government surveillance here. So generally, it was a nice approach for try to have the digital tracking without the Shin Bet, without the enforcement agencies, just the general enforcement surveillance agencies. That's it. I'm done. Just to be on time.
No, thank you very much. Yes, I hope that we have a bit more time to go over some other issues that people may have here in the chat. But before that, just lastly, pass to Carlos to talk very briefly about Brazil, just to sum up our different environmental experiences. And please, if you have questions, put here in the chat so that we can try and answer them in the end.
Oh, thank you. Can you hear me now? Okay, good. So very, very quickly, in order to save time for questions. First of all, I'm just say that it's a great pleasure to be among friends to discussing this very, very important issue, and it's really very positive to see the network of centers serving as a host for this super important conversation. So very quickly, a general picture on Brazil. So starting from a legal standpoint, Brazil doesn't have a general data protection law in force. Brazil has approved a general data protection law that is pretty much GDPR inspired, but the law is supposedly entering into force in August. So it's really unfortunate that we're going through the discussion of using data during the pandemic without our general data protection law being in force. And quite the opposite, there is already in the National Congress a discussion to postpone the entry into force of the law to January next year, because due to the COVID-19 crisis, governments and companies will need more time to adapt to the law. So this is just to provide a legal framework to this whole discussion. So no general data protection law in Brazil so far. And I know that our friends from other countries are reporting about the usage of contact tracing technologies. That's not happening in Brazil so far. So what we are having in Brazil mostly are on the state level or in the city level, the usage of data to collect a general idea or heat maps on a social distancing index that is done by simply trying to, using supposedly anonymized data to make sure that we have a visual on in which spots of the city or in the states you have a concentration of people or people moving from one side to the other, but those are not individual data. So we don't have this sort of granularity so far, and a lot of states are using that. One thing that is important to understand is that on the federal level, the federal government so far has not used that type of technology. Quite the opposite. The government was approached by a group of telecom operators, and due to some uncertainty on how those projects would maybe hinder or restrict privacy, the government has refrained from using data to combat, to fight COVID-19 so far. There is a political take on that because our president see some of the governors as political rivals, and therefore they want to make sure that on the governmental level you have that type of control, that on social media and social network you see a lot of commotion saying this is violating my privacy, this is something that is related to a dictatorship or something like that. So making sure that there is a political fight against the usage of personal data to track the spread of the virus in Brazil. And because of that, I think it's important to mention there is a very recent study that connects the most visible speeches that have been done by the president, minimizing the pandemic, or saying that this is just a flu. You might have seen this on the news. So there is this very recent study that ended up connecting a decrease in the social distancing index being or happening right after the most notorious speeches by the president, minimizing the seriousness of the spread of the virus. So this is interesting because it shows that people are trying to make sure that we can use data on some degree, but nothing related to contact tracing or the other projects that we see on different countries. I think it's just important to mention that for now in Brazil, one of the key questions is Brazil has been under a sort of a quarantine regime really soon in comparison to the US. We are under quarantine regime at least 10 or 15 days before the US end up doing so. And this is important to mention because what we do have right now is that people want to get back to work, and some governments and some authorities on the city levels are starting to move ahead in opening business, in opening stores and shopping malls. But as Brazil end up not having this knowledge, this awareness, or clear view on the status of the pandemic, because first, we are not doing mass testing, quite the opposite. Per 1 million citizens, Brazil is testing really few people. I think what we have right now in total is 63,000 tests being done in Brazil. So per 1 million, we are testing less than 3,000 people in Brazil. So that's a really important topic to consider. And second, as some governments and cities end up moving towards opening the stores and the commerce as a whole, there is this fear that we are going back to normal too soon, because we don't have a clear view on the widespread of the virus, and we don't have the usage of data as we could do in Brazil so far. So I'll stop here for us to have more room for questions. I see there are already some questions in the chat, but this is just to give you a landscape on Brazil, not having a law on data protection, highly politicized debates over social media on the usage of personal data and how to use that, and the country preparing to open up or going back to normal without having a clear view on the widespread of virus in the country. So thanks, I'll stop here. So go back to you, Selena.
Thank you. So we'll still have here at least 10 last minutes. I don't know if people can stay a bit longer, if that's possible, but let's work with our initial time limit here. And just as we won't have time, unfortunately, to go over all the questions, I would just ask that some participants can try and respond them offline. We will get back to you. We have the contact of you guys, and we'll try to do that. But maybe just to get two questions together here from Urs and from Yves D'accord. We mentioned that I think you guys can all read here in the chat, but they are asking about the fact if you think that there will be eventually we'll have to the emergence of this health passport that will be eventually asked by countries, and if that's already in the verge of happening, I don't know, in Korea or Israel, and maybe Malavika in Singapore. What are your takes on that?
Hi, Selena. On Or's question, very quickly, I think something like the Trace Together app has very deliberately been architected to allow this kind of interoperability, which I think actually Urs knows more about than I do. But I think the idea is very much that it can work across jurisdictions, and that a lot of the features that have been built into the app are to enable federated means of tracing across countries. And to allow participating countries or national health authorities to actually do this, and to share it across national borders, and to give healthcare authorities a more comprehensive picture. But I think Urs's question is a really great one, because I think it's one of these questions around where you have a clash between data sovereignty on one hand, where you might have the data kept locally on your phone, or you might be able to consent or not consent to certain things, coming up against the idea of national sovereignty and national borders. And I think that tension is something that I think it's an evolving space. It isn't completely resolved. And I think, again, the app might implement a particular kind of architecture that can work across jurisdictions, but I'm very wary of a technical solution to a legal or social or governance problem. So I think the fact that you might have different social norms, you might have different privacy legislation, I think a mere app can't immediately solve for all of those things. So I think there needs to be a lot more work to look at governance challenges. And I think Eldar or Carlos might have a little more to say on that.
So Urs has raised, I think, one of the key questions that I think about it all the time, although I'm not, I wouldn't say I'm an international law scholar. So in that sense, there's a lot of questions which I'm trying to talk with those who are experts in this, and I'm trying to get the same answers as Urs does, and I'm not sure. I think that there's much to be taught from here, that's for sure, and especially when we talk about international relations and how different states and domestics are actually acting upon it about this differently. And I think that technology might come in hand, like Malavika suggested as well, but there are a lot of shortages to that as well. And I actually don't know. I don't know what will happen, and I think that it will take time until we'll actually understand the ramifications of this virus, that to know if second waves occur, for instance, or other things occur for the long run, which might affect international travel. I don't see international traveling going back so soon, unfortunately. But who knows? As for the second question, I think that we have to differentiate between the principle of proportionate, to have something which is proportionate. In Israel, it is a very important thing that we consider when we violate privacy. This is part of our semi-constitution, or our basic law for human rights and dignity. For when we have these measures, they have to be proportionate for the means. So I think that what you referred to mainly was the purpose of limitation, in the sense that this data would not be used again for other purposes. And we do have this, at least by law or by the regulations, this data should be erased. It is only kept for 60 days by the Ministry of Health for knowing and researching it afterwards, but essentially it will not be reused for other purposes by our internal secret services. This is at least how it is supposed to play out.
And very quickly, if I can just jump in, there might seem a mismatch right now, and going on Urs' question, which is, we will need international coordination to make sure that we come out of the crisis. But most of the solutions that we are applying so far, they are the national solutions, and everyone talks about this rise of nationalisms and the closure of borders as the solution that has been implemented in the first place, and how that might pose a challenge for regional initiatives and more cohesive initiatives throughout different regions. So I think that's probably one of the biggest challenges, because if we focus only on the national level, we will lose the bigger picture, and without this bigger picture, we will not be able to build a solution that will take us to a future in which we find safe and secure ways to deal with the legacy of this pandemic, especially when it comes to data protection and to the usage of data. Certainly when people think about the new normal that is coming up, how data is going to be used, especially sensitive data related to health, that's a key element in building this new normal, this new future that is ahead of us.
This is a KS. I think that we may not, we may need international coordination, but also we need some formation of international standard on privacy. As I said, Korea is the only country, the Korea, Singapore, I think Israel, through temporary legislation, are the only countries that allow this non-consensual, non-judicial location tracking of people who have not, people who are not criminal suspects. whether this is allowed for health purposes, public health purposes. We looked and could not find any resolution. I think that more countries may follow suit. I know that all the attention right now is on the prospective location tracking, but for me, what has been really effective, someone raised a question about efficacy of all this location tracking. I think that there is a lot more money involved, a lot more lives at stake on the retroactive location tracking, because there people, because they don't know that they are infected, they make contact with a lot of people, and because they make contact with a lot of people, that's how the Korea government could identify people to test, worldwide targets of test. That's how they could, with confidence, use, divert their expensive testing resources onto those people who are in the same building, who are in the same shop, who are in the same restaurant, and all of that was done, without getting consent from either the people who were infected or the people who were in the same building. It's like if you're in the same building, you'll get an SMS text from local government that you are in the same building with an infected person. You should right now the law requires rules require them only going to self-quarantine. But most of the times, they would rather get tested than going to quarantine, because quarantine is more invasive on them than just getting the test and just getting tested and getting it over with. So a lot of people were tested, and that's the story behind the Korea's success. And I hear so many times Korea being celebrated and praised as an example to follow, and I'm hoping that they don't get to the legal part.
So I just wanted to add something about, which I forgot to say before, about the shield, which is important, because what I witnessed was that it was done, as I said, it's consensual, you don't have to do it, and there's a lot of privacy by design there. I mean, the privacy issues there are really almost don't exist, which is amazing. However, the problem was, and as I see it, and I don't have any empirical data about this yet, hopefully I will have, we don't know how many people actually downloaded and used it. And one of the biggest problems, as I saw, and I talked to people who have been, that they don't want to do it. And I mean, the layperson would never download it for the reason that they say, well, we already have these regulations, which everyone follows us, and we have the surveillance issues. Why would we consensually have this app on our phones that tracks us? And they don't even understand, even if you explain it to them, that the privacy issues here don't even exist generally, in the sense that it doesn't track you and everything is locally on the device, and you don't even have to report if you are affected, but they don't want to download it. They don't understand the privacy issues by that. And then you have a problem. You have the governmental regulation, in the sense that actually enable a very, very intrusive form of surveillance. And you have like the civil app, or it's not civil, but it's an app which is it's not for the internal services, which is actually good for the civilians, but they don't want to do it because they fear of surveillance. So I just wanted to raise this, this issue, which is, I think, important for the debate.
So I think we are unfortunately really close to ending this conversation, and I think it would be nice for us to hear from Dr. Leo again, who kindly also agreed to be part of this conversation. He had some comments, and also we just would like to be nice to hear from him how the medical community is following all these initiatives, and how it's been this interaction, and if he could just give us a last message so that we can finish this call, and we will try and get back to you with the answers from all the people that participated really nicely here in this chat. Okay, so Dr. Leo.
Hi, thanks, Selena. Just a very quick feedback about data anonymization. I mean, I think no matter what anyone says, it would be impossible to anonymize this type of personal data. It's not going to happen. We cannot trust that claim that it will be able to de-identify this data. It's not going to happen. I think what is going to be very important is that there has to be complete transparency with regard to how the data is being used. And my final message is that there has to be a certain degree of trust for all this technology to work without trouncing upon civil liberties. I think we're gonna have to give up some of our privacy if we are really indeed, if we'll be able to end this pandemic. But this is gonna work in governments where the people trust their leaders, where the people trust their scientific experts. And without that trust, the system is going to fall apart. So I'm just going to end it there. It's great to be part of this webinar, and I hope that there will be more of these coming out soon. Thanks.
Oh, great. Thank you again for everyone who, we had more than 100 people here in this call in very different time zones. We'll let you know if we're the idea is to try and organize other similar talks. And again, we have to thank you again for the Berkman Klein Center, people that were engaged in having this call being set up, and also for all our colleagues in the network of centers. So I don't know if Urs, you want to have a to finish our conversation again. So thank you again.
Thank you, everyone. Thanks to all the speakers. And I just wanted to invite everyone to give a virtual clap of hands, and thanks to Leo, who's not only thinking about the issues we're talking about here, but is actually saving lives. So thank you for all your work and what you do for us. Thank you, Leo. Bye, everyone, and have a great day. Stay safe, and we'll be in touch. Thank you.
Sandra, are you gonna make a copy of the chats? Sandra? Selena?
Yes, a copy of the chat we will do a copy
okay.
of the chat, and there will be a summary of the session available later on the NOC website, but happy to share that with the speakers, the chat copy.
And also I noticed that it has been recorded. Who should I mean, I don't know.
I can share that with you, KS.
Okay, all right, great, thank you.
Okay, thank you, bye-bye.
Bye.
Bye, everyone. Great to see you.
Hi, Malavika.
Hi,
Bye
KS.
now.
Are you in Seoul?
Yes, I just got out of a 14-day quarantine, mandatory quarantine, and I had to install this tracking app for 14 days. So they know that I don't step out the house.
Oh my goodness. I'll be in touch with you separately because we're launching a series next week. We were supposed to do it a couple of weeks ago. And it's one speaker each time. And I would love you to speak about Korea. So I'll be in touch.
Yes, let's do that.
Okay,
thank you.
Great. Thank you. Bye.
Bye, Eldar.
Bye, KS. Thank you very much.